Dr. George P. Canellos is one of the founding fathers of modern oncology. His passion for research, patients, and his students has set the standard for the thousands of physicians around the world who have followed in his footsteps. George Canellos was born in Boston and attended Boston Latin School before studying at Harvard University. Dr. Canellos received his MD from the College of Physicians and Surgeons at Columbia University. In 1964, at the National Cancer Institute, Dr. Canellos, along with Dr. Vincent T. DeVita, helped develop the earliest combination chemotherapies that led to the first successful treatments for Hodgkin and non-Hodgkin lymphomas. The team also developed CMF, another combination therapy that led to one of the first successful regimens in the treatment of early breast cancer. The regimen set new standards of cancer care and is still in use today. As former chair of the Lymphoma Committee of the Cancer and Leukemia Group B, a national American cooperative trials group, Dr. Canellos initiated many practice-changing clinical trials of cancer therapies, including the first successful therapy for lymphoid transformation of chronic myeloid leukemia. As president of the American Society of Clinical Oncology and editor-in-chief of the Journal of Clinical Oncology, Dr. Canellos has had major impact on formulating the direction and intellectual depth of modern cancer research. He is currently a senior clinician at the Dana-Farber Cancer Institute and the Brigham and Women's Hospital, as well as the William Rosenberg Professor of Medicine at Harvard Medical School.
Thanks to Castle Connolly Ltd. and to all of those who participated in the selection process for this award. It is really with great humility that I accept this award. In the field of clinical cancer research, many of my colleagues are similarly worthy of this tribute. I've had the honor and the privilege of working with many of them and given my age, having trained a great number of them over the years from my time at the National Institutes of Health in Bethesda to the Dana-Farber Cancer Institute in Boston. On occasions such as this, one reviews one's lifetime endeavors in order to determine what factors, if any, contributed to one's career. I can only conclude that my success, such as it is in no small way due to a 52-year relationship with my wife, Jean. She supported, sustained, and reinforced the moves which encompassed my career. More importantly, she was a partner in life and succeeded in raising our 3 sons to be the fine contributing people that they are, and this gives me great satisfaction. Jean is a long-term cancer survivor and a cancer fighter who has found time in a very busy schedule to raise money for cancer research and for patient participation in patient services. My field is clinical cancer research, and it is designed to apply the therapeutic contributions of basic science to the patient. Not all new approaches have been successful, but some have worked because of the team effort of clinicians, clinical scientists, and basic scientists in the development and evaluation of new treatments. We've made progress in the last 20 or 30 years. Not enough, obviously, but the process is intrinsically slow. Already diseases which were universally fatal when I started in medicine, such as many of the lymphomas and some rarer leukemias, are now in the curative category. There have been significant successes in management of many of the solid tumors, including breast cancer and gastrointestinal malignancies, and Dr. Larry Norton, who's in the audience, is a contributor to that field. I'm optimistic for the future because science is moving ahead, and in its ability to characterize tumors for their genetic composition and any mutations that might exist, against which we can design inhibitors that will serve as anti-cancer treatments. There are already successful examples of such targeted therapy in the management of patients with cancer. In addition, we've developed specific antibodies directed to sites on the cancer cell that are effective in affecting tumor suppression. It's my honor to be numbered among the investigators working on these various projects. The fight against cancer goes on and will continue, and in some instances by physicians whom I've helped to train. That is my pride, and that is my legacy. Thank you very much.
Well, it's indeed an honor to be here and to be recognized by Castle Connolly Ltd. The field that I'm in, medical oncology, is a fairly new one and really hasn't been around for more than 30 years. I think that Castle Connolly has honored Larry Norton, a former fellow of mine, in the past, and Jay Freireich, Emil Freireich, 2 years ago, all of whom really got their start at the National Cancer Institute in Bethesda, where I think we all were inspired to work in this field and continue to work in this field once we left Bethesda. And so I'm very pleased to receive this honor. I'm very honored to receive this honor. And I think it's a recognition of our field as well. And that's of more importance to me than anything to me personally. And so these are people I worked with, these are people I trained, and that to me is very, very important. Thank you.